Hello. To President LeMay, Interim Executive Secretary Bryan, to each of you, members of the Women's Baptist Home and Foreign Missionary Convention of North Carolina, to all of the officers, to our general body officers, it is indeed an honor for me to have the opportunity to talk to you today from a healthcare perspective about COVID-19 and particularly about the vaccine that is being offered currently for the disease. I'm thankful for the opportunity to participate in this one-day session. I have historically been a participant, and this is a historical event because we are doing it virtually. And so we're going to do the best we can to try to answer all of the questions that you might have. I've tried to anticipate questions, and we're going to do the best we can to try to answer those questions for you. If at the end of the presentation you have questions, please get them to the headquarters office, and I will try to answer those questions for you. So I want to talk today about COVID-19, and we've spent a lot of time, and you've heard a lot about COVID-19. You've seen it on the news, you've seen it, you've heard it on the radio, you've seen it on Facebook and Twitter and all of the social media platforms. You understand the symptoms and side effects associated with it, but I do want to spend a little bit of time talking about those things, and I also want to spend a little bit of time talking about how to boost your immune system, and then I want to talk about the vaccine. It may not necessarily be in that order, but I want to share some education with you today. One of the things this pandemic has shown us is that we have a lot of disparities in our country. This includes economic disparities, it includes disparity with food, and certainly there is a huge divide when it comes to information. And I believe that there is an information gap that must be filled. And so we've spent a lot of time on platforms like this, on the radio, trying to share information with our brothers and sisters, particularly in the Black and brown communities. It's extremely important that we understand this disease and how it affects each of us. First, let me say that COVID-19 is the disease that's caused by the coronavirus. And so in order to have COVID-19, you have to contract the coronavirus. Now, coronaviruses have been around for quite some time, but this particular virus is the novel coronavirus or the new coronavirus, and it is contagious, and it can be quite lethal. And that's why it's extremely important that you each understand the symptoms, the side effects, how you contract it, and then the things that you can do to not contract it. And then we also need to talk about the vaccine as well. We don't necessarily have a treatment for COVID-19. We have what we call a treatment cocktail. We have remdesivir that you get if you're in the hospital. We have monoclonal antibodies that you receive as an outpatient, but there's actually no cut and dry cure for it. And so I always tell people, you know, an ounce of prevention is worth a pound of cure. And so if you don't contract it by doing the things that we've asked you to do for the past 9 to 10 months, then you really don't have to necessarily worry about a cure per se, because you won't contract the virus. So let's talk a little bit about COVID-19. I've already told you that COVID-19 is the disease caused by the coronavirus. It has not been seen, this particular coronavirus has not been seen before, and you can get COVID-19 or the coronavirus through contact with persons who are positive. And what I want you to know, and I know you've heard this before, but I want to talk to you about this. Remember that about 40% of the people who have coronavirus are asymptomatic. They don't have any symptoms, and so they don't even know that they have the virus, and so they spread it throughout the community. We now in North Carolina are recognizing community spread, and it is quite significant. You've seen the maps probably now on TV where they show a map of North Carolina, and you see orange counties, you see yellow counties, and then you see orange counties, and then you see red counties. We started with 10 red counties, which means significant community spread, which means that out in the community, when you're out at the grocery store, when you're out at Walmart, you are at risk for significant community spread. And so we started with about 10 counties when we started this way of measuring it, and now we're up to about 90 counties. North Carolina has a COVID-19 coronavirus problem. We know that we have had over 7,000 deaths to date because of coronavirus. We also have multiple cases, over almost 600,000 cases have been diagnosed. And these are the cases that we are aware of. Remember, there are people who are out there who have coronavirus, but they don't know it. And so they don't get tested. And so they don't even know they have it. So I believe that the cases are far more than what we are aware of. But here's an important fact. Hospitalizations are up significantly across the state. Individuals are hospitalized at a significant rate. When we first started with COVID-19, and I will say just even 6 weeks ago in North Carolina, we had about 1,200 people hospitalized per day. Currently, we have over 4,000 people hospitalized in the state of North Carolina. Some of those people are in intensive care units, and they are very, very sick. Our hospitals in Cumberland County have a lot of patients. My hospital has a lot of patients. And so, when we think about this virus, we've got to think about what it does totally, not just economically, but what it does to your healthcare system. Our healthcare system is strained because people aren't following the recommendations that we're giving regarding not contracting or how not to contract coronavirus, and thus lead to COVID-19. And so our hospitals are strained across the country. They are full, and we have to be cognizant of that. And they're full because we have a large percentage of coronavirus or COVID-19 patients. And we're also still taking care of the people who are typically hospitalized for stroke, for cancer, for heart attacks, or whatever people are typically hospitalized for. So it is important that we as a people recognize that there is a strain on the hospital systems, and we have to be cognizant of that, and thus we have to be cognizant of our movements. We also need to recognize that African Americans play or have a disproportionate share of hospitalizations. Now, if you look at the data and you look at it number to number, you will see that white Americans are affected more. But when you look at it proportionately, compared to the number of black and brown people who live in the state, when you look at it that way, we have a disproportionate share of people who are contracting the virus, and of people who are hospitalized because of the virus, and of people who are dying because of the virus. And we, as people of color, black people, brown people, need to be cognizant of that, and we need to be reticent in our the way we handle COVID-19. Particularly in our gatherings. We are a people who enjoy gatherings. Historically, that's who we are. We enjoy our church meetings. We enjoy going to our parents and our grandparents and our children's homes. But I encourage you to really think about that over the next 6 to 8 weeks, because it's a critical time. It is crucial. The next 6 to 8 weeks are unbelievably crucial. Right now, we are seeing the fallout for the Thanksgiving holiday in our hospitals. Emergency departments are full. If you don't believe me, if you ever need one and you go to the emergency department, your wait is going to be a long wait. We're dealing with Thanksgiving, and then right after Thanksgiving, we have Christmas, and then right after Christmas, we had New Year's. All of those are typical gathering holidays, and so people gathered. And now we're seeing the fallout from that, from sickness associated with the virus and from COVID-19. And so with that, I want to encourage us, think about how you have your worship services. I applaud all of our pastors and our leaders, our faith leaders, who recognize that this is a very dangerous time for our people. A lot of our parishioners are older, and bringing them into a sanctuary together is concerning. And so I applaud those who stuck it out and who've been committed to virtual services and things like that. I'm not judging anyone, but I'm asking you to be really responsible, think responsibly about how you move forward, particularly over the next 6 to 8 weeks with worship services. And so with that being said, I really want to talk about let's move to the vaccine. Who should get the vaccine? I actually believe everybody should get the vaccine. It's almost like previous vaccines we have. All of us have been vaccinated against tetanus. All of us have been vaccinated against measles, mumps, and rubella. All of us have been vaccinated for, a lot of things. And I really do believe that, polio, we've been vaccinated against polio, and we've really eradicated polio in the United States and really across the world for the most part, because people are getting vaccines. I recommend getting the vaccine, and I do understand that there's some concern about it being what's called a new technology. And the truth of the matter is, this technology has been around for quite some time, and it's been studied for quite some time. Thinking about a new vaccine, there is significant cost associated with that, and really the companies that are working on those vaccines now didn't recognize a return on investment that would equal the amount of money they would have to spend in developing the vaccine. The federal government has backed the development of this vaccine by pouring billions with a B of dollars into this industry so that they could get this vaccine out and get it to the people. And so, when you hear, they just did this over the past 6 months, really the technology has been for quite some time. And so I don't want you to be fearful of that. We've talked about who should get it. We've talked a little bit about the vaccine. I want to tell you how it's given. It's given in 2 doses through your arm, the muscle in your arm. The doses are about 3 weeks apart. There have been several trials done with the vaccine. Right now, the federal government has approved the Pfizer vaccine, which is the vaccine I received, and they have also approved Moderna. AstraZeneca has a vaccine that they're still working on, and it's supposed to be a 1-dose vaccine, but right now the Pfizer vaccine and the Moderna vaccine are 2 doses. Trials have been done. Over 75,000 people have participated in these trials, about 45,000 in the Pfizer trial, and about 35,000 in the Moderna trial. And, there's just not been a lot of untoward effects associated with it. Now, I know that you say, well, these trials started 5 or 6 months ago, and that is true. And I'm going to be perfectly honest with you. I had concern initially about the vaccine. But for me, as a physician, the things that I look at, the litmus test for me is, one, is it efficacious, which means does it work? And then number two, is it safe? And then number three, do the benefits of getting it outweigh the risks of getting the vaccine? And so, believe you me, I have looked at the data. I will continue to look at the data and answer those questions. What we have so far and what we know so far is, to answer the question number one, is it efficacious or does it work? The data that we have shows that it does, that the Moderna vaccine and the Pfizer vaccine, they both work to the tune of about 95% effectiveness, which is a good thing. So yes, I was able to check yes on that one. Number two, is it safe? As I look at the safety profile that we have right now, based on the previous 6 months of data or 5 months of data that we have, I've not seen anything that would keep me or prohibit me from getting the vaccine. Yes, there have been people who have had reactions to it, and that is with any drug, that is with any medication. There will be people who will have reactions, but I've not seen reactions in a number that would discourage me from taking the vaccine. So, one, is it efficacious? I checked yes. Two, is it safe? From what we know right now, yes. So I checked yes. And then the third piece really ties into the second piece. Do the benefits outweigh the risks? Well, here we are 5 months in to data that we've collected, and I've looked at these data, and I've got to determine, do the risks of taking this vaccine, do the benefits of taking this vaccine outweigh the risks or the potential risks of taking the vaccine? Yes. Why do I say that? I've said it to you before. We have almost 370,000 deaths in the United States from COVID-19. We have over 21 million people who have been affected by the coronavirus. In North Carolina, we have 7,000 deaths to date from COVID-19, and over almost 600,000 people that we're aware of who have tested positive. So of taking the vaccine, share some of those with you. When I look at the side effects of taking the vaccine, and I look at the benefits of taking the vaccine, I don't want COVID-19. I have seen people suffer from COVID-19. You know people who have suffered from COVID-19. I don't want COVID-19. So when I look at the three things that I look at as a physician for any new medication, is it efficacious? Yes. Is it safe? The safety profile that I have so far says yes. And then number three, do the benefits outweigh the risks? For me, they absolutely do. So I took the vaccine 3 weeks ago. I had no serious issues with it. Some of the side effects I'll share with you now. Injection site pain, tiredness, headache, muscle pain, chills, joint pain, fever, all of these mild issues. And then, of course, there have been people who have had difficulty breathing and things like that. And that's why when we give the vaccine, we ask you to sit and wait for 15 to 30 minutes so that we can make sure you don't have a reaction. Because if you're going to have a major reaction from it, typically it's during that time. And the people giving you the vaccine are prepared to treat any type of untoward effect you may have. I took it again 3 weeks ago. I had a little bit of tenderness in my arm for about a day. The second day, I went about my business, had a little bit of mild calf achiness. It wasn't really even enough for me to determine if it was related to the vaccine or not. I actually wore a pair of boots that day, so I don't know if it was a pair of boots or the vaccine. The next day, I felt a little bit of achiness in my arms and my legs, but nothing that stopped me from doing the work that I typically do every day, which is walking the halls of the hospital or what have you. I took 2 Tylenol, and I was fine. Here, this past Tuesday, I took my second dose of the vaccine, and I've had absolutely 0 symptoms associated with my second dose. And so with that, I only have a few minutes, and maybe President LeMay will allow us to have a conference call a little bit longer if you all want additional information, and that's a decision she can make, and I'm happy to do that if she wants to pull that conference call together. But I encourage each of us. Now, there is no, we are not going to force this vaccine on anybody. I want you to think about it, make your own decisions, do what's best for you and your family. But the final piece of this is, even though we have the vaccine, we still have to practice the 3 W's for now, because we've only vaccinated about 4 million people to date. It is going to take some time to offer this vaccine to the entire population. Right now, the vaccine is offered free. It doesn't cost you anything. In the state of North Carolina, we have vaccinated healthcare workers. Now we're moving to vaccinating people over the age of 75. And other essential workers. And so listen out on the radio and on TV and in your newspaper and on social media about when facilities, hospitals in your community, and when health departments in your community are going to offer the vaccine to your particular group. Feel free to call your health department to get information. Go online and look at your health department to get information, so that you will know when those vaccines are being offered. You should know that here in Cumberland County, we opened up to 75 and above, and we have had lines of people in line to get this vaccine. And so I really want you to think about that. But as I was saying, you have to still practice the 3 W's. You have to wear your masks. You have to wait at physically distance. And you have to wash your hands. And then I have a 4th. The 4th is refrain from small or large gatherings. I don't care where the gatherings are. Refrain from small and large gatherings at least for the next 6 to 8 weeks. And then certainly last but not is a rule, hard fast in my house. If you do not live with me, you do not cross my threshold, period. The people that live with me come into my home. Those that don't, they do not. Now, with that being said, if I have to have some work done at my house, or, if you are going to visit let's say, elderly parents, or you are responsible for taking care of them and taking their groceries in and things like that, for goodness sake, have them wear a mask and you wear a mask. And wear that mask in an uninterrupted fashion, meaning don't take it off. When you go to take groceries or whatever to the elderly, when you go to your mother's house or what have you, wear a mask, have your mother don a mask, and do it in an uninterrupted fashion. We have to decrease this virus spread in our community. And I am 100% convinced that you can do it. We can do it. We have gone through a lot of issues and we've seen a lot of things, but you can do it. Last but not least, people are worried about trust. You're thinking about the Tuskegee Institute failure with the syphilis trials. You're thinking about eugenics sterilization up in the Dorothea Dix area. And all of those things are true. I get it. They're all true. But here's the difference with this. This is a worldwide virus. Those things were germane to the United States. This is a worldwide virus. So it is not just a United States virus. These medications are going worldwide. Think about that as you make your decision about getting the vaccine. I'm going to end now. Again, thank you very much for this opportunity. I think it's extremely important that we share information, and I think President LeMay, in her wisdom, bringing this to our convention, giving me the opportunity to talk to you, is a wonderful opportunity to share information and to decrease that information gap in our community, and I'm thankful for that. Again, I am more than happy to do Zoom calls with you or members of your congregation, or I should say members of your association. That may be the easier way if President LeMay decides not to do a Zoom call from the convention. If there are associations who would like for me to do a Zoom call with your pastors or with your religious leaders, feel free to do so. I'm going to take a point of privilege and ask that you reach out to our convention office and speak with the team there so that they can get me that information. Know that I love you, I care about you, I want what's best for you, I want what's best for your families. Please listen, please practice the 3 W's, and wear your masks. Thank you. Have a blessed day. I love you, and may God bless you and continue to smile upon you.